Hi everyone. So today we're going to be going over the endocrine system. And when we're talking about the endocrine system, we're talking about the hypothalamus, the thyroid glands, the pancreas, the ovaries, pituitary gland, the parathyroid system, thymus, and adrenal glands. So what the endocrine system is it contains 9 major glands and organs that produce, store, and secrete hormones. So today we're going to be going over identifying the chief function of endocrine glands. We're going to be able to describe the general function of hormones. We're going to be able to explain the relationship between the hypothalamus and the pituitary gland, discuss the regulations of levels of hormones. We will list endocrine glands and the hormones they secrete, name other organs that are not classified as endocrine glands but do secrete hormones. We're going to outline information to include when taking the health history of a client with an endocrine disorder. We'll be able to describe physical assessment findings that suggest an endocrine disorder. We'll be able to list examples of laboratory and diagnostic tests that identify endocrine disorders. We're going to discuss the nursing management of clients undergoing diagnostic tests to detect endocrine dysfunction. We're going to be able to define and describe this concept. We're going to be able to notice risk factors for impaired hormonal regulation, recognize when an individual has signs of impaired hormone regulation, and be able to provide appropriate nursing and collaborative interventions for optimizing hormonal regulation. So when we're talking about the endocrine glands secrete hormones, and these chemicals that accelerate or slow physiological processes, they go directly into the bloodstream. Now, this characteristic distinguishes endocrine glands from exocrine glands, which release secretions into a duct. The hormones will then circulate in the blood until they reach receptors in target cells or other glands, and they usually play a vital role in regulating homeostatic processes such as metabolism, growth, fluid and electrolyte balance, reproductive processes, and sleep and wake cycles. So as you can see in the picture on the right, you will be able to see where anatomically these glands are and what generally they look like. Question number 1. Is the following statement true or false? Endocrine glands secrete hormones into a duct. False. Exocrine glands secrete hormones into a duct, and endocrine glands secrete hormones directly into the bloodstream. So the pituitary gland, or it could also be called hypophysis, is connected by a stalk to the hypothalamus in the brain. Now, there's a lot of endocrine glands that respond to stimulation from the pituitary gland. The pituitary gland is divided into 3 lobes. So it's the anterior lobe, which is also called adenohypophysis, the intermediate lobe, which is called pars intermedia, and then the posterior lobe, which is called neurohypophysis. Now, the pituitary gland is also called the master gland because it regulates the function of other endocrine glands. But this can kind of be misleading because the hypothalamus will also influence the pituitary gland. So some of the hormones that are released in the pituitary gland, so in the posterior pituitary gland, we have the antidiuretic hormone, ADH. Now, what this does is it increases water absorption from kidneys, and that essentially will raise your blood pressure. And then the posterior pituitary gland will also release oxytocin. Now, oxytocin stimulates the contraction of pregnant uterus and release of breast milk after childbirth. And then let's talk about anterior pituitary. So anterior pituitary gland will release somatotropin, which is also known as the growth hormone. And what this does is it stimulates bone and muscle growth, and it promotes protein synthesis and fat mobilization. The anterior pituitary gland also releases prolactin, which it will promote production and secretion of milk after childbirth. We also have the thyroid stimulating hormone, TSH, which will stimulate production and secretion of thyroid hormones. And then we have adrenocorticotropic hormone, which will stimulate the adrenal cortex to secrete cortisol and other steroids. The anterior pituitary also releases the luteinizing hormone in females and the interstitial cell stimulating hormone in males, and this initiates ovulation and secretions of sex hormones in both genders. And last but not least, it will release follicle stimulating hormone, which is FSH, and this stimulates development of ovum and ovaries and the sperm and testes. So the hypothalamus is a portion of the brain between the cerebrum and the brainstem, and it projects down toward the pituitary gland. Now, this creates a pathway for neurohormones, and neurohormones are also known as releasing hormones or factors that stimulate and inhibit secretions from the anterior and posterior lobes of the pituitary gland. So under the influence of the hypothalamus, the lobes of the pituitary gland secrete various hormones, like the hormones we just talked about in the slide prior. So since we're talking about neurohormones, there are 6 hypothalamic neurohormones. So there is the thyrotropin releasing hormone, and this stimulates the release of thyroid stimulating hormone, TSH, from the anterior pituitary gland. Then we have the corticotropin releasing hormone, which is CRH, and this causes the anterior pituitary gland to secrete adrenocorticotropic hormone. We have the gonadotropin releasing hormone, which triggers sexual development at the onset of puberty and continues to cause the anterior pituitary gland to secrete luteinizing hormone and follicle stimulating hormone. We also have growth hormone releasing hormone, GHRH, and this results in the release of somatotropin, which is the growth hormone, from the anterior pituitary gland. So with the growth hormone releasing hormone, it's controlled by another hypothalamic hormone, somatostatin, which is also secreted by other tissues outside the hypothalamus, such as the pancreas. So let's talk about somatostatin. This inhibits GHRH and TSH and also blocks the secretion of several gastrointestinal hormones, including gastrin, cholecystokinin, and secretin, and it lowers the blood flow within the intestine, suppresses the release of insulin and glucagon from the pancreas, and suppresses the release of exocrine enzymes from the pancreas. And last but not least, we have the hypothalamic dopamine, which inhibits the release of prolactin from the anterior pituitary gland. Now, dopamine, of which there are 5 variants, is produced in several structures within the brain, and one of them is the hypothalamus. So when we're talking about the hypothalamus, we also need to keep in mind hormone regulation. So a feedback loop controls hormone levels. Now, a feedback loop is a mechanism that turns hormone production off and on to keep concentrations of hormones within a stable range at all times. Now, feedback can be either negative or positive. So most hormones are secreted in response to negative feedback, or a decrease in levels stimulates the releasing gland. In positive feedback, the opposite will actually occur. So most endocrine disorders result from an overproduction or an underproduction of specific hormones. Question number 2. Is the following statement true or false? The hypothalamus creates pathways for neurohormones. True. The hypothalamus creates pathways for neurohormones that stimulate and inhibit secretions from anterior and posterior lobes of the pituitary gland. So in this picture right here, we see the relationship of the hypothalamus to the pituitary gland and the hormones secreted by the anterior and posterior lobes of the pituitary gland. We see the adrenocorticotropic hormone, antidiuretic hormone, follicle stimulating hormone, growth hormone, luteinizing hormone, and thyroid stimulating hormone. So the thyroid gland is located in the lower neck, anterior to the trachea. So as you can see in this picture right here, visually, that's where you'll find the thyroid gland. Now, it's divided into two lateral lobes, so side by side, joined by a band of tissue called the isthmus. Now, the thyroid concentrates iodine from the food that we eat, and it'll use it to synthesize tetraiodothyronine, or also known as thyroxine or T4, and also triiodothyronine, which is also known as T3. These hormones regulate the body's metabolic rate, and calcitonin, another thyroid hormone, inhibits the release of calcium from bone into the extracellular fluid. Usually if there's a rise in the serum calcium level, it'll stimulate the release of calcitonin from the thyroid gland. So the parathyroid gland, there are small bean-shaped bodies, and they're surrounded by a capsule of connective tissue and embedded within the lateral lobes of the thyroid. Now, there are 4 parathyroid glands, or at least usually. Some people might have more than 4. So the upper parathyroids are found posteriorly at the junction of the upper and middle thirds of the thyroid, and the lower parathyroids typically lie among the branches of the inferior thyroid artery. They secrete parathyroid, and which will increase the level of calcium in the blood when there is a decrease in the serum level. The parathyroid does so by causing calcium and phosphorus to be released from the bones, and it also does this by interfering with the urinary excretion of calcium, but also promoting the urinary excretion of phosphorus. And then it'll also activate vitamin D, which causes an increase in calcium absorption within the intestine. So the thymus gland is located in the upper part of the chest above or near the heart, and it secretes thymosin and thymopoietin, which helps in developing T lymphocytes, which is a type of white blood cell involved in immunity. So the thymus gland is large during childhood, but will generally shrink by adulthood, and despite it shrinking over time, the thymus gland continues to support the production of T lymphocytes, but the rate of production will decrease as we get older. So functional disorders of the thymus gland are usually rare. So the pineal gland is attached to the thalamus in the brain, and it secretes melatonin, which aids in regulating sleep cycles and the mood. And melatonin is actually believed to play a role in the hypothalamic pituitary interaction. So as you can see in your slide, the picture on the left, that is the pineal gland. So on the right-hand side, those yellow triangle-looking things, those are the adrenal glands, and those are located above the kidneys. So the outer portion, as we can see, the yellow part, that's called the cortex. And the inner portion, so the pink part, is called the medulla. The adrenal cortex manufactures and secretes glucocorticoids, mineral corticoids, and small amounts of androgenic sex hormones. Collectively together, these hormones are called corticosteroids. So glucocorticoids and mineral corticoids are essential to life, and they influence a lot of the organs and structures of our body. So glucocorticoids such as cortisol, which affects your body metabolism, suppresses inflammation, and helps the body withstand stress. Mineral corticoids, primarily aldosterone, maintain water and electrolyte, so sodium, potassium, chloride. They balance those out. The androgenic hormones will convert to testosterone and estrogen, And anabolic steroids, which are derivatives of adrenal androgens, promote the development of muscle mass and other masculinizing characteristics. So let's talk about the adrenal medulla. So the adrenal medulla secretes epinephrine and norepinephrine. So these two hormones are released in response to stress or a threat to your life. They facilitate what is referred to as the physiologic stress response, or we know it as the fight or flight. And many organs respond to the release of epinephrine and norepinephrine. And the responses include increased blood pressure, pulse rate, dilation of your pupils, constriction of blood vessels, bronchodilation, and decreased peristalsis. So our main responsibility when with the patient who might have an endocrine disorder, we want to prepare the client for laboratory and diagnostic testing and explain the general purpose of the test, the type of test that they're going to get, and how it will be performed. By doing this, it decreases any nervousness or hesitation they might have. And we want to encourage the client and family to ask questions, discuss the results with the physician, and we can also consult the institution's procedure manual and the physician's order for the required preparation for each diagnostic procedure. So some tests, such as the CT scan, require no special preparation other than a general explanation, whereas there's other tests that might require fasting and require temporary eliminations of certain foods from diet. So we really have to break it down for them and explain why. Hormonal regulation is a complex physiological process with integrated responses involving various glands, hormones, and the action of hormones on the target tissues. Although each gland and hormone has a specific function, collectively hormonal regulation has 5 overarching functions: fetal differentiation of the reproductive and central nervous system, sequential growth and development during childhood and adolescence, reproduction, metabolic activity, and adaptive responses. Imbalances of hormonal regulation can lead to significant health and social consequences, and this concept focuses on the normal process of hormonal regulation, hormonal imbalance, assessment, and interventions to optimize hormonal balance. So the term hormonal regulation is often used to describe a specific group of hormones or metabolism. The focus of this concept is broad, encompassing the general regulatory processes, including hormone production, secretion, and action. Clearly, the function and physiological action of each hormone are unique, and a presentation of details for each gland, each hormone, and conditions associated with imbalances is not intended, but rather a perspective. Now, given this perspective, what is meant by hormonal regulation? For the purpose of this concept, hormonal regulation is defined as physiological mechanisms that regulate the secretion and action of hormones associated with the endocrine system. So when we talk about an endocrine gland, we're referring to a specialized cluster of cells, tissues, or an organ that produces and secretes hormones directly into the bloodstream. This distinction is important because there are other types of glands, known as exocrine glands, that excrete other non-hormonal substances or fluids through ducts to body organs, cavities, or the skin. Some examples include sweat glands, salivary glands, mammary glands, and Bartholin glands. Exocrine glands are excluded from this concept presentation because they do not secrete hormones. A hormone is a chemical substance that stimulates cellular action in target tissues. Target tissue refers to the specific tissue that hormones can influence. A final term worth mentioning is receptor site, which refers to the location on the surface of a cell where hormones attach and gain access to the cell, allowing for physiological influence. Hormones are produced by glands, and the structural categories of hormones include protein and peptide hormones, steroid hormones, and monoamine hormones, with the majority being protein or peptides. Many physiological functions are directed by hormones, which serve as chemical messengers that influence or control functions of other organs or body tissues. Hormones are produced and secreted by endocrine glands, and the secretion of a hormone by the gland is in response to a certain level of a substance, for example, sodium or glucose level, or in response to an alteration within the cellular environment. Once secreted from the gland, hormones are then transported to their target tissue. In some cases, the target tissue is adjacent to the endocrine gland that produces the hormone, but more often than the hormone is transported to one or more target tissues throughout the body by the circulatory system. Water-soluble hormones circulate in the blood in free form, whereas most lipid-soluble hormones bind to a carrier for transportation. Hormones have very specific cellular effects, but only on designated cells within the target tissue. So hormones actually will depend on receptor sites to gain access and exert their specific physiological action within the cell. Target cells then have unique receptor sites for the designated hormone, much like a specific key is needed for a lock. For this reason, hormones are unable to influence cells unless they have an appropriate receptor site allowing a hormone to act on a cell. And the more receptors on the cell, the higher affinity or sensitivity the cell has for that particular hormone. The cell has the ability to adjust the number of receptors based on the concentration of circulating hormone. When the circulating concentration of a hormone increases, fewer receptor sites are needed, and when the concentration decreases, more receptor sites become available. When we want to control hormone secretion, maintaining them in a physiological range is accomplished through feedback systems. And although the specific mechanism varies depending on the gland or the hormone involved, there are 4 types of feedback control, which are negative feedback, positive feedback, biological rhythms, and central nervous system control. So when we're talking about negative feedback, this is the most common type, where information regarding a hormone level or the effect of a hormone is communicated back to the gland that secretes a hormone, which directs the need for hormone secretion or suppression. One of the simplest examples is the secretion of insulin based on serum glucose levels. So when the serum glucose rises, the pancreas secretes insulin. Insulin has an effect on transporting glucose into the cell, and serum glucose levels drop. So the pancreas inhibits insulin secretion. In this example, the glucose levels trigger or inhibit the release of insulin. It's a little bit more complex when there's multiple glands and hormones involved, but the same general process applies. For positive feedback, this occurs when an increasing level of hormone triggers further elevation of hormone stimulation. An example would be with the menstrual cycle, in which luteinizing hormone is secreted by the pituitary gland, which triggers the ovaries to secrete estradiol, which in turn stimulates the pituitary gland to secrete more luteinizing hormone. Biological rhythms is controlled. So the secretion of some hormones are controlled by biological rhythms. And an example is the influence of the circadian rhythm on cortisol secretion. So cortisol secretion is highest in the morning and lowest in the late evening, and disruptions in biological rhythms and sleep deprivation can affect the normal secretion patterns on some hormones. And last but not least is the central nervous system stimulation. Another type of control mechanism for the secretions is through this. For example, when an individual experiences a stressful situation, the sympathetic division of the autonomic nervous system is activated, triggering the release of epinephrine from the adrenal medulla, which is the fight or flight response. And when the perceived stress is resolved, the adrenal medulla reduces the release of epinephrine. So glands and the actions of hormones are influenced by the aging process, particularly during adolescence and among older adults. So when we're talking about adolescence, reproductive glands and hormones lie mostly dormant during childhood and become active at the onset of adolescence. During puberty, the anterior pituitary increases secretion of gonadotropins, which is luteinizing hormone and follicle stimulating hormone. In the male, this stimulates the maturation of the testes and production of testosterone and development of external genitalia. In the female, this stimulates estrogen production, the maturation of ovaries leading to ovulation, and development of external genitalia. In older adults, in response to advancing age, most glands become smaller with reduced hormone production. This does not necessarily lead to hormonal regulation impairments, but the physiological activity of the hormone is reduced, which is then linked to some common physiological changes associated with aging. So, for example, frailty has been shown to be associated with a pattern of hormonal changes in elderly men. Although menopause in women occurs as a normal response to aging and is associated with a reduction of estrogen produced by the ovaries. Reduced metabolism results in cold intolerance and reduced appetite. A reduction in the production of antidiuretic hormone also occurs, leading to a more dilute urine and thus leaving the older adult more at risk for dehydration. Many problems can lead to hormone imbalance. So, two general categories of hormone imbalance that can occur for each hormone secreted by endocrine glands are hormone deficiency or excess. Problems with hormone deficiency or excess are usually associated with an issue in the production or secretion in the regulatory mechanisms directing the glands. Now, the glands can be affected in a number of ways, though. It could be trauma, congenital, genetic, inflammatory conditions, autoimmune conditions, even tumors. Damage to a gland can result in a reduction or a loss of the ability of that gland to produce and secrete a hormone. So, for example, damage to the thyroid gland can result in the inability to produce thyroid hormones. There's a number of conditions that can result in an excessive production and secretion of a hormone. Signaling errors, which are caused by improper levels of other hormones or ineffective negative feedback mechanisms, can lead to excessive production or inhibition of hormone secretion. Some other physiological triggers that can result in undesired elevations or deficiencies in hormones. For example, excessive and sustained stress can result in chronic elevated cortisol and interruption of the circadian cycle, so maybe from sleep deprivation, can result in reduced secretion of melanin. Although hormonal deficiency or excess is often caused by a production or a secretion problem, there's a lot of other variations that can occur where the hormone loses its effect on the tissue or it's unable to gain access to the cells because there's a problem with the receptor sites. And this is referred to as insensitivity. A classic example is type 2 diabetes, where insulin insensitivity develops at the receptor sites. So, understanding the physiological consequences of hormone imbalance requires an understanding of the physiological effects of the hormones. So, an excess or deficiency of any hormone can create significant physiological challenges. The severity of such effects can vary pretty widely. So it can be from the devastation of a partnered couple experiences with infertility to life-threatening states, such as what we would see in thyroid storm or diabetes insipidus or even diabetic ketoacidosis. Some common consequences from impaired hormonal regulation can include alterations in growth and development, alterations in cognition, alterations in metabolism and reproduction, changes in growth, and altered adaptive responses. The disruption of any hormone production may result in potential complications associated with the underlying condition and the potential for lifetime hormonal replacement therapy. So, although risk factors are typically described at the level of each gland and hormone dysfunction, there are several risk factors that are shared by many hormonal imbalances. One of the most obvious is hormone supplement therapy. Exogenous supplementation of any hormone places an individual at risk for excess or deficient hormone levels due to the variability in dosing needs and medication adherence. So, in response to advanced age, most glands become smaller with reduced hormone production, which increases the risk for certain hormonal deficiencies and reduced metabolism. Obesity and sedentary lifestyle are associated with many hormone imbalances such as diabetes, polycystic ovarian syndrome, genetics, chromosomal abnormalities, and family history, particularly a history of autoimmune responses, increase risk for several hormone deficiencies. So we have to remember that all individuals of all population groups have the potential for problems with hormonal regulation. Risk factors for hormonal imbalance are usually considered in the context of the specific gland and hormone involved. So, for example, the risk factors involving the anterior pituitary gland and the secretion of growth hormone differ significantly from risk factors associated with the hormonal imbalance involving the pancreas and secretion of insulin. Primary prevention refers to strategies aimed to optimize health and prevent disease. So, primary prevention strategies typically include education, diet, exercise, weight control, injury avoidance, and avoidance of environmental hazards. These strategies affect hormonal regulation as well. So, maintaining a healthy lifestyle optimizes overall health and thus provides an optimal physiological environment for hormonal regulation to occur. So, for example, diet, exercise, and weight control affect the production and function of some hormones such as insulin, glucagon, and thyroid hormones. When we take measures to manage stress so that we can prevent excess secretion of cortisol. Maintaining a routine sleep pattern optimizes the secretion of hormones dependent on the circadian cycle, and preventing head injury through the use of helmets reduces risk of injury to the hypothalamus and pituitary gland. For secondary prevention, this refers to the early identification of a disease so that prompt treatment can be initiated. The two primary endocrine related screening recommendations are for thyroid and diabetic conditions and include recommendations for infant and adults. So, for infants, we can do a thyroid screening which is recommended as part of their screening panel. And this screens them for 31 core conditions, including 2 endocrine disorders, which is congenital adrenal hyperplasia and congenital hypothyroidism. In adults, the two pertinent areas for screening include thyroid and diabetes. We basically do screening for abnormal blood glucose and type 2 diabetes mellitus in adults who are at risk for diabetes. all body systems are affected by hormones. And because of this reason, health and illness concepts are interrelated in some kind of way. Intracranial regulation has a significant role in the hormonal regulation because of its influence on the function of the hypothalamus and pituitary glands. Many hormonal imbalances occur as a result of brain injury or damage to these glands located in the brain. Likewise, optimal intracranial regulation and cognitive function depend on normal regulation of hormones. Maintaining balance of fluid and electrolytes is highly dependent on the secretion and regulation of aldosterone and antidiuretic hormone. Glucose regulation and nutrition are highly dependent on the regulation of insulin and glucagon. Stress has a close relationship because of the role that glucocorticoids and catecholamines play in the stress response. The process of development and reproduction are dependent on hormones such as growth hormone, estrogen, progesterone, testosterone, luteinizing hormone, follicle stimulating hormone, prolactin, and oxytocin. The nurse performing a routine examination of a patient experiencing syndrome of inappropriate antidiuretic hormone will expect which of the following findings? 1. Dry, furrowed tongue and excess dilute urine. 2. Signs of fluid retention and minimal urinary output of concentrated urine. 3. Elevated levels of sodium and excessive thirst. Or 4. Elevated levels of sodium and potassium with signs of hypovolemia. Question number 2. The nurse is preparing discharge instructions for a patient who had a left adrenalectomy to treat pheochromocytoma resulting from a tumor of the adrenal medulla. Instructions should include information on glucocorticoid replacement therapy, 2. Information on mineralocorticoid replacement therapy, 3. Information on both glucocorticoid and mineralocorticoid replacement therapy, or 4. None of the above because information on normal postoperative recovery as replacement therapy is unnecessary.